So when we're measuring our EKG leads, we have to remember these normals. So we're going to talk about what everything means and the process you're going to go through when you analyze your EKGs. But first you have to have this set information. You have to memorize this stuff. So the PR is 0.12 to 0.20 seconds. QRS is less than 0.12 seconds. QT is 0.32 to 0.4 seconds. And then the heart rate, 60 to 100 beats per minute. You have boxes on your EKG paper. Each little box is 0.04 seconds. So whenever you're measuring a bunch of different boxes, you can just count how many boxes you have. Let's say you have 10 boxes for something that you're measuring. You just say 10 times 0.04. Okay, and so you would just move your decimal. That would be a measurement of 0.4. If you have 5 boxes, as we have here, 5 times 0.04, 5 times 4 is 20, move your decimal, it would be 0.2. Okay, so your little boxes are worth 0.4, and your big box on your paper is 5 little boxes, so it's 0.2. Okay, and that's all in seconds. We're not going to worry about amplitude or height at this point. We're just going to keep it simple and do the basics right now. Okay. When you look at a strip of EKG rhythm, there are multiple ways to figure out the rate. The easiest way is to take a 6-second strip and multiply by 10. Multiply how many beats you have times 10, because 6 times 10 is 60 seconds in 1 minute. Okay, so what you would do is, there's these little hash marks, these little lines when you look at your EKG paper. Each section, each little hash mark denotes 3 seconds. You could just count, right? We know that each little box is 0.04. We know that the big box is 0.2, and you can actually count and figure it out, okay? But they've made it simple for you, where each hash mark is 3 seconds. So when you guys are looking at a strip, just cut it off so that all you have are 2 hash marks, and now you know that you have 6 seconds. So however many beats you have in there, okay, you look at your beats, and you would just count how many beats do I have and multiply that by 10, and that will tell you how many beats per minute. That's the simplest way. It's going to give you just a guesstimate, and of course it's also going to give you a rate. The computer's going to count. Remember, the computer only counts the way you have it set up. Sometimes it counts everything. Sometimes it only counts the stuff that you want. So you have to be really careful with the computer. So this is a way to kind of double check the computer. So if the computer says that it's 85 beats per minute and you count 8 beats in a 6-second strip, 8 times 10 is 80, then you know that you can probably trust the computer measurement. Okay? So you have to know the normals. All right? And I'm going to put those up behind us so that we have those for reference. You always, whether you have a note card or a piece of paper, you're taking a test, you want to write it down so that you have it. Okay? Make sure that you can kind of see that a little bit here. All right, so those are our normals. Okay, so this is my adherent EKG. All right, so let's understand what we're looking at. Because it's important, not only can you analyze a strip, but you got to know what the heck you're looking at, okay? So if we break up the heart, we have 2 atria and 2 ventricles, right? We have the SA node, sinoatrial node in the right atrium, and that is the pacemaker of the heart. That is the cell that is in charge and sending out all of your first signals, okay? So it's the leader. Then you have here in the ventricle, the atrial ventricular node, and that's the AV node. And the SA node sends out an impulse and tells the AV node, okay, it's your turn. And then the AV node sends out electricity to the ventricles. Okay, keeping it simple. So that is reflected here on our EKG rhythm. Okay, so this right here, this SA to AV, is the PR. The P wave here. This is the QRS. Okay? Whenever you're trying to figure out where do I measure, okay, you have to remember that you have a baseline. When your heart is not doing anything, there's no electricity going at a certain moment, that's baseline here. When your heart is just at rest, that's your baseline. So you always are measuring when something goes above baseline, as it leaves baseline, you're measuring, or as it returns to baseline. So you may, when you're first starting out with your EKGs or you're refreshing, you can look at your baseline is where your P's start, where your QRS's start, where your T's come back to, where everything starts and comes back to. That's your baseline. You might want to draw a colored line along it when you're getting started. So if you're trying to figure out where does my QRS start, where does my T start, that kind of a thing, you're looking at where does it leave baseline, where does it start to go up, or where does it return to baseline. That's maybe where you stop measuring, okay? So this is your P wave. It's really a P to Q. These things are not named properly, okay? This is your Q. This is your R up here, okay? This is your S where it's come back to baseline, and this is your T wave here, okay? And then it comes back to baseline here, all right? So that is your PQRST. So when we're looking at our PR interval, we are looking at how long does it take the electricity to travel from the SA node to the AV node through the muscle tissue, okay? And we know that it should take 0.12 to 0.20 seconds. Maybe there's some scar tissue, maybe the patient's had an MI, and now they have a dead area and the scar tissue area, and the electricity has to go around it. It would take longer, okay? So the PR is how long it takes here for your electricity to get through your atria. Where do we measure that? We measure that here. P to the start of your R, which is your Q. This is PR, okay? Your QRS is from here to where your QRS comes back to baseline, okay? This is your QRS. Your QRS is how long it takes for your electrical impulse to go from your AV node. It got the message, and now it's relaying the message through the ventricles, okay? This is your PR, this is your QRS, all right? Your T wave is your rest period. The T wave is, so that your QRS is your ventricular contraction. How long does it take for your ventricles to get the electricity through them, okay? And then your T wave is your rest period. That's your filling period. That's when the heart is, or the electricity is recovering and getting ready and building up, getting ready for the next electrical impulse, okay? And we measure the QT from here, okay, to the end of the T wave. That's why your QT is so much longer, 0.32 to 0.4 seconds, okay? So that is kind of the general what we're looking at here with your heart and your electricity.